Hey everyone, Dr. Charlie Johnson, physical therapist at Physical Therapy in Johnson, and I want to talk about the first type of stiff and painful shoulder. So if you've seen previous videos, I talked about how arthritis can cause a stiff and painful shoulder, and a frozen shoulder can cause a stiff and painful shoulder. So today we're going to talk about frozen shoulder, okay? So what I have here is basically 5 signs that you might have a frozen shoulder, which is causing your arm to be stiff and painful. Okay, so first things first, if you're watching this and you are a female, you are at a higher risk for a frozen shoulder. We don't exactly know why, but it happens more commonly in women than it does men. Okay. Also, if you're between the ages of 40 to 60 years old, that's sort of the ideal range. Not ideal, but that's the range where frozen shoulder most commonly occurs. Okay. If you've watched one of my previous videos on a simple test that you can do to determine if you have a stiff and painful shoulder, we talked a little bit about the arm by side rotation test. Okay, so you have a positive arm rotation test, meaning your arms by the side, you try to rotate them out to the side, and maybe you can only go halfway or not even halfway on the side where your shoulder hurts. Okay, so that just means that the shoulder doesn't move as well as the other side. Okay. The other thing is a lot of times there's a progressive sort of loss of motion, maybe over the last few months, and now you're starting to notice it more and more. It's a very generalized kind of shoulder pain, but a lot of times it keeps you up at night, so it can be very painful in the early stages, and then a lot of times it just gets very, very stiff. Okay. And finally, just wanted to throw this in there. A lot of times we see, and again, we're not exactly sure, but we see a link between people who have diabetes or other thyroid conditions who end up developing frozen shoulders. So there might be a weird little link there. Again, we're not exactly sure why, but something to think about. So if you're watching this video, you've tried arm rotation test, you think maybe you fit some of these criteria and you think you may have a frozen shoulder, the treatment, while it can take some time, is, again, to get the shoulder moving better and to educate you about what you can do to relieve your own pain. Okay, so reach out to us, 484-552-3767, if you want to get started getting back to normal.